Thank you so much for joining us this evening. My name is Bracha Rutner, and I am a Yoetzet Halacha, and this evening, we will be speaking to you about pregnancy and laboring on Shabbat. Perry, Dr. Friedman, would you like to introduce yourself?
Sure. Sorry, my audio for you cut out, so I wasn't sure. I'm Perry Friedman. I'm a OBGYN and specifically a maternal fetal medicine specialist, or one of the high risk OB doctors. Live here in Michigan, and I'm really excited to have been asked to be a part of this wonderful cause and to be invited by Nishmat. So I'll let you start.
Okay, thank you so much. When we think about pregnancy, childbirth, and postpartum, we're often thinking about two lives that we're trying to protect. The mother, who is a living, breathing, independent human being, and the fetus that is not yet an independent, living, breathing human being. Ideally, we would never have a conflict with regard to saving the life of either the mother or the fetus and Shabbat. In fact, the Gemara in Nida on Daf Lamed Chet Amud Aleph describes to us how the Chasidim Harishonim, the early Chasidim, would have intercourse on a Wednesday, Shelo Yavo Nishotehem B'leida Chilul Shabbat, so that their wives would not give birth on Shabbat and would therefore prevent a need to violate Shabbat. This, of course, is not something that we're really in control of. And I believe, though, that the point of the Gemara was to show that if we can try to prevent the desecration of Shabbat, we try. However, what happens when there's a conflict between Shabbat and childbirth? Do we view a pregnant woman in labor as pikuach nefesh, someone whose life is in danger? And how does our definition of saving a life in general impact not only life-saving measures that we may need to perform during a labor, but how much we can we do? And for how long after labor are we able to implement these life-saving measures? So I thought first we'd go ahead and take a look at pikuach nefesh in general, the concept and the idea of the preservation of life. There are many guidelines in the Torah for when we need to be mechal Shabbat, when we need to go ahead and violate Shabbat for someone in need. If we look in source 1 on the source sheet, the Pasuk in Vayikra says to us, Ushmartem et chukotai ve'et mishpatai asher ya'aseh otam ha'adam v'chai b'hem. We should keep the laws and the statutes and live with them or live through them. And that language of v'chai b'hem, to live with them, is very significant. The Gemara in Yoma on source 2 tells us v'chai b'hem v'lo sheyamut b'hem, that we should live by the mitzvot and not die as a result of them. And the Tosefta in source 3 continues and says, Ein lacha davar she'omed bifnei pikuach nefesh. There is nothing that stands in the way of pikuach nefesh. Nothing that stands in the way of guarding one's life and of preserving one's life. This mitzvah of pikuach nefesh, of not allowing anything to stand in the way of saving a life, supersedes almost every prohibition in the Torah. It's not simply a waiver to say one is only allowed to do certain actions and not others, but it's an obligation. It's a mitzvah for us to go ahead and preserve life and to go ahead and save life. Obviously, there may be limitations. That's beyond the scope of what we're speaking about tonight. But it's an important mitzvah, and it's something that we need to go ahead and do. And in fact, the source 4 in the Gemara in Yoma emphasizes this, and it talks about how mefakrim pikuach nefesh v'Shabbat. We can go ahead and do everything to preserve life on Shabbat, and not only are we supposed to preserve, v'zariz harei ze meshubach, The faster that we do it, the quicker that we do it, we're praiseworthy. And we don't wait to go ahead and ask a question. We go ahead and we do what we can immediately. In fact, the Gemara, the Yerushalmi in Yoma, it's not on your source sheet, but it says that one who waits, one who is not Zariz, one who waits to ask a question from Beit Din is actually considered disgraceful. And it's as if they are actually potentially partaking in the murder of that individual. That's how far the Gemara goes. And that's how important and significant this mitzvah is of saving a life. And the Rambam in source 5 codifies this. And it says, Kisha osim dvarim elu. When we go ahead and we try and implement life-saving measures that force us to go ahead and violate Shabbat or violate other halachot, this in particular Shabbat, we don't do them through non-Jews or through young children because we don't want to say that we should consider Shabbat, this is not an ideal. Because maybe we're saying we're allowed to do it al yidei goyim or yidei ktanim or yidei avadim because this mitzvah pikuach nefesh, well, it's not so important. No, rather, al yidei gedolei Yisrael v'chachmeim. This is not saying that we need to go ahead and ask the question, but the gedolei Yisrael, the chachamim, should go ahead and be the ones to go ahead and do this. Because imagine you're walking on Shabbat and you see a Rav that you know, or you see somebody that you know that is very, very careful about halacha, and there's a life-saving situation, there's a situation where somebody is injured, and they're the ones who pick up the phone. That sends a very strong message to us about how important this mitzvah is. And I think that the idea from the Rambam, adding on to the idea of v'chai b'hem, in bold it says, she'ein mishpatei haTorah nekama ba'olam. The statutes of the Torah, the laws of the Torah, are not there to go ahead and cause nikama, to go ahead and bring revenge in the world. Ela rachamim v'chesed v'shalom ba'olam. The whole point of the Torah is to enable mercy, to enable kindness into our world. And by going ahead and recognizing that we don't stand by the letter of the law, we stand by the spirit, which are the people who are performing those mitzvot, the people who are in the world, that those are much more important than the mitzvot and the Torah. It sends a very strong message about how much we violate, how much we value life, and how far we can go in terms of violating mitzvot. And in fact, sources 6 and 7 add on to this, that idea from the Yerushalmi of participating in the murder, potentially, if we're not zariz, if we don't quickly go ahead and save a life. In Vayikra it says, Lo tamod al dam reacha, we're not supposed to stand on our brothers or blood, in the sense that we are not supposed to idly stand by and watch someone whose life is in danger and not do anything. We can't just stand there if we have the ability to intervene and to go ahead and help out. And we also see in the next source in the Gemara in Yoma that it's not just Shabbat. There are examples in this Gemara of someone who has some kind of illness on Yom Kippur, and we go ahead and we feed them. And we don't just feed them food. We may go ahead and feed them tevel, nevela, which are foods that we're not allowed to eat, foods that you're actually potentially liable for either death if you eat them under normal circumstances or other punishments. We can go ahead and feed this to this individual who is ill. We're violating Yom Kippur and we're violating other mitzvot. And the Gemara specifically emphasizes this because it shows us the value of life and how far we can go and how much we can do to go ahead and preserve a life. And we see this continued in source 9 in the Shulchan Aruch, that here in source 9, we actually see different levels of illness on Shabbat with different actions that we can go ahead and do. So first, the Shulchan Aruch talks about Mi sheyesh lo michush ba'alma, someone who's just not feeling so well. She'ein bo chashash sakana klal. There is no real danger to their life. V'hu mitchazek v'holech kibari. And this is an individual who can go ahead and walk on their own, and they're relatively healthy. They're just not feeling well. They might have a little bit of a headache. Asor la'asot lo shum refu'ah b'Shabbat, afilu al yidei nachri. Right? We do not violate Shabbat to go ahead and help this person. There might be situations where we could, but really because they're not seriously ill and there is no danger to their life, we're really not supposed to go ahead and violate Shabbat in any way. Right? Now, someone who has a danger, Misha yeshlo choli shel sakana, mitzvah. We see that language again. Mitzvah l'chalel alav et Shabbat. Someone who has a real danger to their life, it is a mitzvah for us to go ahead and violate Shabbat. And we see the same language of v'hazariz hareza meshubach. Someone who does this quickly is praiseworthy. V'hashoel hareza shofech damim. They're considered a murderer. V'hanishal hareza miguneh. And if you go ahead and you wait to be asked, it's something that you're not supposed to be doing. And then the Shulchan Aruch adds on, va'afilu safek nefashot dochet haShabbat. Even someone who is in a potentially dangerous situation, it's not necessarily dangerous right now, but it might be dangerous in the future. This was also a situation where we can go ahead and violate Shabbat. Okay? And generally, the Shulchan Aruch says that we should use types of medication that we know about and types of medication that we are aware of in order to go ahead and save this person. But if there's a medication that we know might be allowed and might be helpful, then we can go ahead and use that medication if a doctor goes ahead and recommends it. There's also a middle category that the Mishnah Berurah talks about in source number 10, which is someone who is really not feeling well. It's not a danger, but they need to go ahead and go to bed. They can't really walk around. They're feeling so ill. Sometimes you get those headaches where you're so ill that you need to lie down. That might be a situation where we could go ahead and potentially violate Shabbat. So we see from all of these sources the importance of saving a life, the value of saving a life, the chesed, the rachamim that the Torah wants to bring into the world through recognizing the value of life. So we see that we can violate Shabbat and other mitzvot in a case where someone's life is in danger, whether it's in danger right now or is potentially in danger. We would imagine then that a woman who's in labor, who's giving birth on Shabbat, whose life may be in danger, and the fetus who may be in danger, then on Shabbat we can do whatever we need to save her life. We will look at the sources for an interesting perspective. But first, I think it's important for us to go ahead and look at some of the life-saving techniques that are done to save a woman or potentially to save the fetus. Dr. Friedman, can you share with us some life-saving measures?
Absolutely. So, Bracha, as you mentioned, an obstetrician and a high-risk doctor or a midwife really has the unique opportunity to be caring both for two patients, the mother and the fetus. Generally speaking, when they decide that a fetus is in danger and they need to act rather quickly, interventions that they may do on behalf of the fetus include emergently delivering the baby either by a cesarean section or expediting the delivery by way of what we call operative vaginal delivery, so the use of forceps or the use of a vacuum. Other scenarios where a fetus may need some sort of intervention, but it's not necessarily beneficial really to deliver a baby. Maybe in scenarios where the baby is anemic, there are number of reasons why a baby could be anemic, but sometimes we may need to do a procedure where we have to give baby a blood transfusion. Those things rarely occur in an emergent scenario, you know, on the weekend or over Shabbat, but really can happen on a Chag, which I would presume has, you know, similar halachic, you know, considerations. But those really are for the fetus. When it comes to maternal interventions and maternal life-saving procedures, I mean, you know, generally when one understands that, what are the things that pose a life or put mom at risk for, you know, mortality, it could be anything related to acute hemorrhage, which is oftentimes in the setting of a delivery or some sort of trauma. It can be cardiovascular collapse, you know, the heart stops functioning well or stops functioning at all. It can be blood clots that, you know, compromise the lungs, or really, you know, extremely high blood pressures that put people at risk. And so, you know, interventions that may occur, again, one is immediate delivery, but this time it's really to save mom, which also oftentimes saves baby. But other interventions might be, you know, commonly people hear, you know, a DNC, blood transfusions, uterine artery embolizations, any other surgery that may be needed to stop bleeding, or for an infection, hysterectomies. Those are generally the interventions, the maneuvers, and the considerations for really for life-saving things.
Okay, thank you. So we see that there are different life-saving measures, and yes, many of the rules are the same for Yom Tov and for Shabbat. I thought, thinking about these different life-saving measures, the sources focus more on the details of a woman giving birth and the halachot surrounding those types of situations. So if we look in source number 11, we see that the sources discuss the details of a woman giving birth. There are lots of other details mixed in. There's an idea of not birthing an animal on Yom Tov. It says, Umiyaldina ta'isha b'Shabbat. We would go ahead and assist a woman who is giving birth on Shabbat. V'korin la chachama mimakom lamakom. We will call here the chachama is the midwife who's helping her to travel from place to place, from wherever she need, even if that midwife herself would need to go ahead and violate Shabbat to get there. Umachalilina leha et Shabbat, and we violate the Shabbat for this birthing woman. The koshrina tatibor, we will go ahead and tie the umbilical cord of the child on Shabbat. And then there's a discussion a little bit more about some of the things that we might do regarding the umbilical cord and the Brit Milah. If we continue and we look in the Gemara expands. So we see here that we are Mechalel Shabbat from the Mishnah. We see that we help her, and that we go ahead and we can call the midwife to come and assist her in childbirth. So then the Gemara goes ahead and says, Mikdei Tani La. One may help birth a woman. The Gemara asks, it says in the Mishnah, Mialdina Taisha v'korin la chachama mimakom lamakom u'mechalilina tashabat la tuyimai. This list seems pretty comprehensive. We can go ahead and help her give birth. We labor on Shabbat. We call the midwife, and we are mechalel Shabbat. It seems very broad and very general, and would seem to go ahead and include anything that we would need to go ahead and help her. The Gemara that wants to know, what exactly does this mean? Are there any limitations to the things that we can do? Is it all no holds bar. What exactly that can we go ahead and do? So the Gemara adds something which I think is very interesting. It talks about im hayta tzricha laner, chavirta medaleket la et haner. If a woman needs a lamp, she herself needs the lamp, her friend can go ahead and light the lamp for her on Shabbat, even though that is a clear desecration of Shabbat. Vim hayta tzricha l'shemen, if she somehow needs some oil to go ahead and make her feel better, chaverta mevia la shemen beyad, her friend can go ahead and bring her the shemen even in her hand. V'im eno sofek beyad mavia b'sa'ara, and if that bringing her hand is not, meaning she can't carry enough, she can somehow bring it in her hair. V'im eno sofek b'sa'ara mavia la b'kli, she can bring it in a kli. So we see that we're doing things that are not necessarily directly mechalel Shabbat. They're lighting a flame, turning on a light, or bringing her oil. Those are additional things that we're allowed to do. And the Gemara goes on and continues and says, Pshita, this idea of turning on a light, it seems kind of obvious. Why would we need to say that? If the light is needed for birth, then we would turn on the light. Why is that something that seems that the Gemara needs to specify? So the Gemara continues and says, Lo tzricha besuma. We're actually talking about a woman who's blind. Mahu detema. What might we think? Kivan de lo chazia asir. She herself can't see. So how is it not how it's not helping? Kamash malan ituve mitzvah data. This gives her a sense of comfort. This concept of yishuv hada'at. She has comfort. She doesn't need the light to go ahead and see anything, but just knowing that the light is on somehow makes the birthing experience more comfortable. That is allowed. Okay? So what we're saying is that what it seems to be saying here in the Gemara is that we're not only talking directly about life-saving measures that we can do to be mechalel Shabbat, because that is explicit in the Mishnah, but we're also saying that we can take measures to give her yishuv hada'at, to give her a certain level of comfort when she is giving birth, and even for that, it's mechalel Shabbat. That is not directly saving her life, but it's making her feel more comfortable. And that is really what the Mishnah is coming to teach us, which is not something that we would think would otherwise be alive. Because in other circumstances, there's a question. But clearly for a woman in labor on Shabbat, at least according to this Gemara, we can go ahead and do whatever life-saving measures we need, and we can go ahead and do whatever it takes to go ahead and make her comfortable. The Gemara goes through about some of the different issues with regarding the oil. And then we say, Dekama de efshar l'shenuye mishaninan. If there's anything that we can do with a difference, I'll explain that a little bit more, we go ahead and do. So in general, when it comes to Hilchot Shabbat, there are certain ways that we are supposed to perform each and every malacha. There's a normal way to go ahead and do the malacha on Shabbat. We go ahead and we write a certain way, writing 2 letters in a certain way. If we do something though with a little bit of a difference, then that malacha, which done in a normal way, in a typical way, would be forbidden on a Torah level and would have the subsequent punishments. We now turn it into a derabanan. We now turn it into something that is asar, or forbidden on a rabbinic level. And we often say that when something is asar derabanan, is forbidden on a rabbinic level, and there's a makom tsa'ar, there's a real need, we can go ahead and do that on Shabbat. Now, we just got through saying that we can be mechalel Shabbat for this woman in labor. And not only can we go ahead and violate Shabbat, but we also are able to go ahead and do anything that we need to make her feel comfortable. And yet now the Gemara seems to conclude, yes, you are allowed to do those things, but if you can go ahead and do anything in a little bit of a different way. So for example, when you turn that light on, maybe turn it on with a different hand, maybe turn it on in a little bit of a different way. If you need to perhaps if the midwife needs to travel, maybe she takes a little bit of a different route. Not that she should necessarily be driving for longer than necessary, but she does something a little bit different in her driving, because then it makes everything that is being done for this laboring woman into something that's forbidden only on a rabbinic level. Now, it's interesting that that would even be an issue, because Rashi even comments, it's pikuach nefesh, all of this, and pikuach nefesh is dochet Shabbat. So if it's all pikuach nefesh, and we know we can violate Shabbat for pikuach nefesh, as we had established in all of the previous sources, then why does it seem that the Gemara now is telling us, oh yes, but you should do everything with a shinoi. Go ahead and do everything with a little bit of a difference. And I'll add to that, which is the Tosfot in the next source, who talks about when the Gemara in Yoma says, Amar chola ein machilino to b'yom haKippurim, ela al pi mumcha. One should go ahead when they are actually feeding a chola on Yom Kippur. They're giving them food because they're not feeling well. One should go ahead and have an expert that they can go ahead and rely on. But here in our case, Sharia mishum yituve data, that the woman is, we're talking here about Yishuv Hadat, Hainu sheyoter yechola hayoledet lihistakein al yedei pachad. What could end up happening? Why is it that this Yishuv Hadat is allowed? This Yishuv Hadat is allowed because what could happen if this woman is fearful, or if she is scared? It could end up leading to the situation being dangerous. Because what might she be fearful? She'll worry that, well, if things aren't exactly the way she had envisioned them, or she thinks that they should go, maybe the doctor won't do as good enough a job in her head. And she starts to tell herself all of these stories about what could end up happening. It could go ahead and put her in danger. So here, we wouldn't do things al yidei mumcha. We wouldn't need an expert, as opposed to what it says in the Gemara in Yoma, at least according to Tosfot. We could simply do it because she's feel comfortable, because we're worried about the danger. Again, if Tosfot says this, if the Tosfot say this, and Rashi says what he says, why is it that the Gemara needs to go ahead and add the issue of shinoi, that we should go ahead and do everything with a practical difference? And I'll add even that the Meiri says in the next source that we go ahead and do whatever we need, whether the woman asks or the woman doesn't ask. And that is also, again, why would we need to do anything with a difference? So we're going to get to that in a moment. But I want us to go ahead and think about this idea of this Yishuv Hadat, of this worry that this woman might have that could somehow, at least according to Tosfot, put her life in danger. And some measures that we may take during labor to go ahead and have a woman feel better. Dr. Friedman, I'm curious, can you share the medical perspective on that? What happens with a woman's mental perspective or her mindset when she's giving birth if she's uncomfortable? Have you seen situations where a woman's mindset or how she's feeling could ultimately impact her labor? Does modern medicine take that into account? And what type of measures might you implement in a hospital or in a laboring setting that might help a woman feel calmer and more comfortable during labor?
Yeah, so it's a fantastic question. I actually just recently had this discussion with my brother-in-law, Jason Goldstoff. It's important really to think and to understand that labor is a complex process. And the pain that really, as you mentioned, that's associated with labor, it's multifactorial. And with that, understanding that no one method of pain control works for all stages of labor. and for all individuals. And equally true, even multiple analgesia methods or interventions, even when used in combination, don't necessarily guarantee a totally painless experience. Modern day labor analgesia can be broken down to simply non-invasive or non-pharmacologic forms, and also, invasive pharmacologic forms. In no particular order, non-invasive or non-pharmacologic, methods include sometimes position changes, which, may be, encouraging the woman to ambulate through the labor and delivery floor, using a birthing ball. Other times, the use of a doula can be very helpful in easing her mind, like you alluded to. Um, Showers, baths, those can particularly be helpful in the first stage of labor. The use of hot and cold compresses also. Generally the non-invasive, non-pharmacologic, those methods we just talked about, are more effective at addressing some of the anxiety I think that you were alluding to, and some of the stress related to the childbirth process and to the anticipated, pushing and childbirth. For more invasive procedures and or the pharmacologic, the medications we use, we can use opioids or morphine, more commonly used in the earlier stages of labor. But we can use nerve blocks, what we call pudendal blocks. We can use nitrous oxide, which is used in certain areas throughout the country. And then, of course, because the epidural or the neuraxial anesthesia. And again, that is those interventions, as opposed to the anxiety and stress relieving that we talked about, really target a lot more of the actual labor pain in the second stage.
Yeah. So we see many of those methods would actually not even be a question of being permitted on Shabbat. Certainly a lot of the non-pharmacological ones, perhaps a bath or a shower might be a question. Many of the others are not. And it's interesting what, if we would look deeper as to what we do nowadays to go ahead and help a woman feel more comfortable and what was done in the times of the Gemara. There may be a lot of similarities. There may be a lot of differences. But going back to our question about why we would need to go ahead and do anything with a shinoi, if we see that Yeshuv Hadad, her comfort, is something that's so important, and this is a situation of pikuach nefesh. Right? So, so first we'll talk about kind of what we would go ahead and do. So I'm going to skip actually a little bit ahead, and we'll go back to some of the sources. If you look later on in Breshit, here, if you look at source, I'm going to skip ahead a little bit. If you look at source 18 in Sefer Breshit talks about the curse that Chava was given after she ate from the Eitz Hadat. And here in Sefer Breshit, it says, El Isha Amar, Hashem turns to Isha, and he says to her, Harbe arbe itzbunech, v'haronech be'etzev telidi, banim, that you will have pain during childbirth. And it's very interesting the way that a lot of the sources ultimately understand that on some level, and we see this language again and again, the pain associated with childbirth and some of the danger is actually on some level considered something natural. Now, this is not to say that we're not Mechalel Shabbat, that we don't do everything that we can to save her life. Certainly, every source says that we do. But the idea of shinoi, and we'll see that idea of doing something a little bit differently, and we'll see how some of this plays out in the sources and then in some practical examples, is because on some level there is an idea that this is the natural part of labor. And therefore, if we can, we go ahead and do anything that's possible with some kind of shinoi, with some kind of change, again, when it's possible. Okay. And then, so if you look now back into source 15, here we see that the Shulchan Aruch addresses a yoledet. But there's an entire section in the Shulchan Aruch that is dedicated to a woman who gives birth on Shabbat, a yoledet. That's what she's referred to. And what does the Shulchan Aruch start with? The first thing that he says, yoledet hi kechola sheyesh bo sakana umechalalina tashabat lekol ma shetzricha. So he says very clearly here, a woman who's giving birth is like a chola sheyesh bo sakana, the same language that he mentioned in terms of a regular chola, and we violate Shabbat for her, lekol ma shetzricha, anything that she needs, and mimic and seeing the same language that we saw in the Gemara, korin la chachama mimakom lemakom. We go ahead and we call a chachama, for her it was a midwife. For nowadays we would say it's a doctor, or some people might have a midwife, to go from place to place. Umialdinota, we go ahead and we labor her. Umadlikina taner, afilu hisuma, we go ahead and we light that candle, even if she is blind. Umikoma kom, and here's that language, the koma shiochala lishnot, anything that we can go ahead and do with a shinoi, anything that we can do with a little bit of a change, mishanin, we go ahead and we change. And he gives some here examples. Kigon im tzrichim lahavila kli, if she needs some kind of vessel that might cause us to violate Shabbat by carrying it. She carries, instead of carrying it in her hand, she would carry it on her head. And any other thing like that, we would do a small change that we would go ahead and do. Okay, we're gonna come back to the next sources. Okay, and here the Magen Avraham tells us, which is a commentary on the Shulchan Aruch, who lived in Poland in the 16th century. His name is Avraham Abel Gambiner. And he tells us something interesting with Dr. Friedman. I'd like you to, after we read it, go ahead and comment on it. And he says that why do we go ahead and do that we do everything with a shinoi? Hachashani, in our case, even though perhaps with a regular chola, with a different type of chola, someone else whose life is in danger, we would not need to go and do something different. Hachashani, in the case of labor, it is different. Because something that labor, the pain of labor, is natural. Ve'ein echad mi'elaf meta machma mileda. And there are less than 1 in 1,000 women who die in childbirth. Therefore, we are stricter, and we say that we should go ahead and make a change in any way that we can. So I'm interested, Dr. Friedman, if you could share statistics, especially thinking he's talking about Poland in the 16th and 17th century. If you could share with us some statistics about women and childbirth, and women's mortality rate in childbirth, certainly in the past and also more recent.
Yeah, so I think it's I don't know that I have stats from the past, but one thing that I think is interesting is when we look at statistics for mortality in maternal mortality, which is essentially defined as mortality in childbirth or during pregnancy, as well as for the first year postpartum. It's oftentimes broken down by resource-rich and resource-poor countries. In resource-rich and high-income, countries like Israel, the United States, the mortality rate is low. And I would agree with him. It was probably 13 per 100,000, 10, 13, 15 or so. In middle income countries, it's probably closer to 180 per 100,000. And in low income countries, it's upward of 360. So it really depends on the resources. Probably one would assume that the many, many years ago, when they didn't have the interventions we have today, that would be considered more of a low income or resource country. But there are so many things that over the course of centuries have changed in terms of women's health and delayed pregnancy, and how that may implicate or impact mortality. So it's a pretty close number, I think.
Okay. I'm curious if it was that way in the 17th century in Poland, but is it true that at some point hygiene, washing hands, made a very big difference in terms of reducing maternal mortality rates, or is that more an urban legend?
No, it's true. And much to I've been shocked in some of the textbooks that I've opened, and you see old textbooks, and the physicians holding things or deliver, and then there are no gloves. So yes.
I guess thank
We've
God.
come a long way.
Yes, thank God for some of our modern medicine.
Yes.
So if we look in source 17, the Mishnah Berurah actually gives us some very practical advice, which I think many women who take Lamaze classes or read about preparation for labor really hear. But the Mishnah Berurah, who lived at the beginning of the Chavetz Chaim, who lived at the end of the 19th century, the beginning of the 20th century, he says, what do you do when you get to ninth month? You get to the ninth month. להזמין בכל ערב שבת כל הדברים הנצרכים לה, תשמן יזדמן לידתה בשבת ולא תצטרך לחלל שבת. What should you do? You should basically get everything that you need ready on Erev Shabbat, so that should you end up going into labor on Shabbat, you won't have to be Mechalel Shabbat. So this has, I always think, when I read this source, I think about the bag that they tell you to go ahead and prepare. This is not only, I think, from a Mechalel Shabbat piece as a side point, I think it's also from a practical perspective that it can go ahead and help. If you think about the Yishuv Hadat, it can ease your mind. But also then everything is already ready. And then you can just pick up that bag, and you might have things in there that are not allowed on Shabbat. So perhaps on Erev Shabbat, you would throw your cell phone in there and a charger, or whatever else you might need in your cell phone. Now, there is a question that does emerge from this in terms of whether you need to prepare a car service every Shabbat. We'll talk a little bit more about driving to the hospital on Shabbat. It does seem that it's obviously fine, but there are some opinions that might say that if you can go ahead and prepare on Erev Shabbat a car service, a phone number. Some people say you should, but it's not a requirement according to most poskim. The Mishnah Berurah here keeps going, and he says, if it's nighttime, afa pi shechavrotea yodet lasot la kol hadvarim hanitzrachim la, afa pi kein kim lehu lechachamim delo mitzveh data diolede kisheroe bechoshach. Meaning, let's say it's nighttime, and this midwife can do everything in the dark. Because we know that likely she will feel more comfortable if it's light. If it's light, we go ahead and we put the light on. And we don't say, even afilu, the source continues to say, ena amer klum. She doesn't say anything. We generally assume that a lit room is going to be something that will make her feel more comfortable. And we can go ahead and turn that light on for her on Shabbat. And here the Mishnah Berurah once again quotes that concept of the fact that we do things with a shinoi, but he adds a very, very important caveat. Okay? And he prints the sense the same idea. Shana mipnei sheke'ev hayoledet davar TV. It's considered something natural. Who ve'ein achad me'elef meta machmat leida. There's only 1 in 1,000, less than 1 in 1,000 deaths that occur in labor. Lefichach echmiru ba lishanot. V'kol zeh, he adds, v'deleka ikuv l'chola. As long as this doesn't impede our ability to help her. Aval imeinu na'aseh bezrizut b'shinoi kimo below shinoi mitzvah la'asot below shinoi. If you can't do it just as quickly with a change as you would do it without a change, it is a mitzvah to do it without a shinoi, l'maher hadavar b'kol kocho, to do this as quickly as possible. So while we do have this caveat that's mentioned in the Gemara about doing something with a change and doing something whether it's to save her life or to go ahead and help her feel more comfortable, the Mishnah Berurah says this has to be in a way that doesn't prevent us from helping her. Because if it prevents us from helping her, and it might, our desire to do something with a shinoi, we get so caught up in the shinoi that we forget that we have a life in front of us and that we need to go ahead and try and preserve her life. It's a mitzvah to do it without a change, and to do it in the typical fashion that we would go ahead and do it in. So we see here, while we have this little bit of this caveat, we still treat the woman like a chola. We can go ahead and violate Shabbat on her behalf, not only for life-saving measures, but also for those things that we need to do, whether she asks or not, whether she says anything or not, what we need to do to go ahead and make her feel comfortable. Now, Rav Moshe here in source 19 talks about the situation where a woman needs to go to the hospital on Shabbat. And there's a question about whether or not we would send, he said, I love Rav Moshe's language, b'davar ha'isha shetucha linsoa b'Shabbat b'taxi la-hospital. She has to travel in a taxi to a hospital, kidei laledet, in order to give birth, u'mefachedet lisa b'atzma. And she is worried or scared to travel by herself. Her husband or her mother would go ahead and travel with her. Mishum debazeh yesh la yituv heda, because this provides her with real comfort. And Rav Moshe goes through some details where he talks about, and he says that maybe she doesn't really need to go ahead and have anybody travel with her. He questions, is it something that's very, very needed? And maybe it won't make her really feel uncomfortable. However, he says, after looking at all of these sources and after going ahead and thinking and researching more on this situation, he says, Mikol makom ledina, kevan dematzinu bioledet, she'alula lehistakin machmat pachad. He brings back that issue that we are worried that her fear will go ahead and cause her to be in danger. Mihu sheyachol lismok al chiluchim b'chashash pikuach nefesh, and therefore we are worried that this will turn from a yishuv hadat situation, from a situation where it was just about comfort, to a situation where it is worry about pikuach nefesh. Lachein im omeret shehi mitpachedet, if she says she really is going to be scared and she cannot go alone, af acharei shemasbiru la she'in ma lefached, even though we say that there really is not much to fear, lisa ba'atzma yesh bazeh gam chashash pikuach nefesh, we're really worried about this issue of it may turn into pikuach nefesh, vitzarich, and if you look at that language, haba'al o ha'em lisa ima. He doesn't just say mutar, it's allowed. He says if she says that this is something that she needs, then her husband or her mother or whoever she requests must go ahead and travel with her. And that is because we are very worried about her yishuv hadat, her comfort, and ultimately we are worried about the danger that not worrying about her comfort might lead to. So even though Rav Moshe was hesitant in the beginning to go ahead and say, is this something that's very necessary? His ultimate conclusion is that yes, if she says that she needs somebody else to come with her, to violate Shabbat by getting into this car, by driving, then not only is it allowed, tzarich, this person must go ahead and do this. Now, if you look in source 20, the Shmirat Shabbat Kehochata, Rav Yeshua Neuwirth, he again says that she's like a chola sheish bo sakana, and v'im yesh tzorach bekach mutar lechalel aleha Shabbat v'yom tov. He adds in here the Yom Tov piece. Ava mikevan, and again he quotes this. Everyone quotes this concept that it's in some way natural. You could do things you should try and do things with a shinoi, as long as it doesn't go ahead and prevent you from doing anything that would cause danger to her. And here he quotes in particular Nituach Kesari, a C-section, that you really should not, if it needs to be scheduled, that if it needs to be, the doctor wants to schedule it for whatever health reasons it needs to. If it can be not done on Shabbat, if it can be pushed off to Sunday or another day of the week, that's preferable. But as long as it's it will not cause her any danger, lo la'im, not to the mother, v'lo le'uberet, and not to the fetus. And once again, he also agrees with that idea of preparing something on Erev Shabbat in order to go ahead and be prepared on Shabbat. Okay? Now, some people do ask the question, should a woman who's in her 9th month go ahead and stay closer to a hospital if the hospital is far away? Here, Rav Neuwirth clearly says, Ein ha'isha chayavet lihimatzeh b'kirvat beit hacholim kvar samuch l'Shabbat. She does not need to go ahead and stay in a place that is near the hospital if she is supposed to give birth close to Shabbat, kedei lihimaneh minisiat b'Shabbat, in order to prevent her from traveling on Shabbat, im yesh koshi b'davar, if this is difficult. And I like his language here, v'chacham einav b'rasho, someone who's really smart. Klomar kasher ha'ishim matchila lahargish b'chavlei lidami ba'od yom, al tamtim ad she'ila yitgabru, ela tisa miyad lebeit hacholim. Don't wait. Meaning if she's trying to give birth on Friday, don't wait. Go ahead and go to the hospital as soon as possible. So we see here this idea of helping this woman with Yeshuv Hada'at and really being concerned about her health and prioritizing that over Shabbat and other mitzvot. Now, here we've talked about giving birth and the dangers that could potentially arise and some of the life-saving measures that we may take to go ahead and either save the fetus or to go ahead and save the mother. There are dangers that arise not only during labor, but there are also dangers that arise after labor. And Dr. Friedman, I'm curious if you could share with us a little bit about some of the dangers that may arise for a woman postpartum.
Unmute myself. Okay. So, the postpartum period is also known as the 4th trimester, which really refers to a time after delivery when the maternal physiology and the physiologic changes that occur during pregnancy are reverting to the, non-pregnant state. Most of that will generally occur by about 6 weeks. But as you sort of alluded to, there are some complications that really can extend beyond 6 weeks. And as I mentioned to you, under the common definition of maternal mortality, really some that can span months, if not close to a year. And so, just to sort of stress the importance of this 4th trimester, about 50% of serious complications and maternal mortality can happen in this 4th trimester time after delivery. About 20% in the first week, about 20 more percent within the first 6 weeks, 42 days, and then a smaller percentage the year after. It's important not to get stuck on those statistics because how they figure it is a little bit complicated, and sometimes the mortality reason isn't really related to really the pregnancy itself, but that's just how things get defined statistically. But complications that are worth I think being aware of is, of course, bleeding. So most often, the bleeding that occurs happens within the first 24 hours, but there can be what we call a secondary hemorrhage that may occur up to 12 weeks after delivery. Things like acute onset of chest pain, shortness of breath, those are things that can happen with complications such as, God forbid, a pulmonary embolism or heart failure. And these things may happen in the first, 5-6 days after delivery. Some maybe up until 5 months after delivery. So it's important not to always just, write things off and say, okay, I'm out of the window, not no reason to call my doctor or be concerned. Other important things are, and this is generally in the first week, is any acute severe fevers or abdominal pain, or perineal pain if you had a regular vaginal delivery and there was any sort of tears, lacerations, those kind of things. Any significant pain, give a call. Those could end up being life-threatening. One of the things that I did want to mention, and I thought about this as you were talking, and we talked a little bit about having the bag ready and the proximity to the hospital concepts. There are certain committees that are geared towards looking at maternal mortality. And one of the common things that has always come up is the concept of delaying. The concept of delaying, which has ultimately led to this 3-delay theory, which is that there are primarily 3 points that we can pick up that a delay in care led to a maternal mortality. Delay number 1 is deciding I have a problem or I need to go to the hospital. Sometimes that arises because there's just a lack of knowledge of some of the symptoms and signs and things to be aware of, or the reluctance to sort of ask, your doctor. The second point for delay is getting to the hospital. People saying, I'm going to wait for so-and-so to come home and take me, or I'm going to take, I live too far from the hospital, I'm going to kind of wait before I do X, Y, and Z. Like delaying in getting to the hospital. And then of course the third is, the delay in, once you've gotten to the hospital, the delay in initiating care, which a lot of that has been addressed in terms of, hospital protocols and different things to cut down on that time. But, I can't highlight and underscore that enough. Have the bag ready. It will delay. You don't have to start looking for important things that you may or may not need. And then also, if and when one thinks it may be an issue, being close to the hospital could be of some benefit. So does that answer the question?
Yeah, it does. So from a halachic perspective, if we go back to source 15, we do see a distinction in terms of the Shulchan Aruch and how we would treat a woman. And this is whether something is really dangerous or not at that moment in time. There's a distinction between the first 3 days. We assume that the first 3 days after labor are the most dangerous. Dr. Friedman, you seem to be saying the first week. That's the second stage for halacha, that until the 7th day, she's still considered within a danger. And then 30 days and up to 30 days, we consider her sort of another stage. And then after 30 days, the assumption is she's generally not in danger. Now, this is assuming that a woman has healed completely. She has had a safe and, I guess, typical birth, and there's no issue that has arisen. Because once there are any of those dangers, the hemorrhaging or the fevers or anything else that may arise, she then switches from her status as being a woman really postpartum to really being in that status of a chola sheyesh bo sakana, an ill person whose life is in danger. And in that case, we do not hesitate, going back to our original sources where we really defined what a chola is, what an ill person is. In that case, we do not hesitate at all to violate Shabbat. So if there is any danger to a woman's life postpartum, immediately call her doctor, go to the hospital, do whatever is necessary that medicine would require in order to go ahead and save her life. And we've seen through all of this, the description of halacha, the connection between halacha and medicine that really play a role, both in what we understood in the past and our more modern understanding of the needs of a woman when she's going through labor. Whether those needs are life-saving measures that we have to go ahead and take, or those are measures that we need to go ahead and take, not because her life is threatened per se right now at this moment, but because we want to make this labor as comfortable as possible for her. And I know, and Dr. Friedman, you can correct me if I'm wrong, but there's a very strong focus now in hospitals when patients come in on their pain levels, right? You come in now and they ask you with smiley faces,
Yep.
where's your pain? How big is your pain? Because I think that there's a deeper understanding of what pain is and how valuable it is and what to understand it and what role it ultimately plays in health. And I think that the Gemara began to understand that, whether they were talking about different types of comfort, but that there's real value in a person who is comfortable in a situation that may be dangerous for their life. So, Dr. Friedman, if you have any closing remarks that you'd like to make about labor and the health of a woman and the health of a fetus.
No, I mean, I would really just, I agree with you. I think it highlights also for me just how sensitive the Gemara and Halacha is to, any sort of suffering. And there are so many, new, again, non-pharmacologic, non-invasive, and sometimes even invasive stuff that are coming up that can really help women through. And labor and pregnancy and childbirth. I mean, of course I chose this field. I think it's one of the most wonderful things to be a part of, and it's a miracle every single time I see it. But there's no question that your doctors and everyone there are really, first and foremost is to keep you and the patients, the fetus and mom, healthy. And obviously the second most important thing is to make sure that everyone's comfortable in the process. So I very much enjoyed listening to the halacha side as well. And it helps me obviously how often I'm in the hospital on Shabbos, taking care of women. So thank you.
Thank you for all your work and your help and your support of women, and for speaking with me this evening. And I thank you for the participants. And I hope everybody has a wonderful evening and has learned a lot. I know I learned a lot in this from Dr. Friedman and in my preparation about all of the different halachot. And there are many other issues that do arise. This is really the foundation of the halachot. And then in different situations, we may apply as needed, because halacha takes into account not only the halacha, but also the individual situation and the individual needs of the person who is asking the question. So thank you so much.
Thank you.